I got chosen to talk about some legislation affecting spine surgery. So I'll tell you, I do kind of do a little bit in this realm in that, I'm a part of the California Association of Neurologic Surgeons. I sit on their board. I go to my House of Delegates on the California Medical Association as well. And so, I know a little bit, but I definitely had to do more research for this topic. But let me see. Okay, so who can name these people that are in Congress? Anyone? Ami Bera, very good. Any others? Ron Paul, yes. So there are 17 physicians in Congress, actually, 4 senators and 13 House of Representatives. So the reason why I bring this up is because when lobbyists want, to push healthcare issues, these are the people that they go to. Okay, so a lot of the bills that are sponsored or co-sponsored, these are the names that you're going to see. So they range from an orthopedic surgeon, ophthalmologist, OBGYN, a fair number of urologists actually too. Ruiz is an emergency medicine physician. Ami Bera is who did general practice. So it's good to get to know these names just so that you'll hear it, right? When you're kind of going through your different like news sites and things like that. So this is like a laundry list and I'm not going to read it to you, but as a physician, as a surgeon, these are some of the legislation that you should already know. And if you don't, you should probably look them up maybe in between your rounds of golf. But so like HIPAA, right? Everyone should really know about HIPAA. And then there are a lot of laws that are also a part of that, like the HCQIA, the high tech, and then there are other like quality laws, the PSQIA, and so these are different laws, and I'm not going to really go into those because I don't think they're all that interesting, but it's important to know. So these are all acronyms that are really important. EMTALA, everyone talks about EMTALA violations when you're at a level 1 trauma center and you can't do that, that kind of stuff. And so, and then Stark Law, obviously, and then the False Claims Act. And so these are just kind of things that I think highlight different past legislation, right, that you need to know. So, what I did want to go into this talk was a little bit more about like what's on the horizon, right? And there's a lot. Okay, so one of the things to know, one of the people to know is there is a new CMS Administrator, Chiquita Brooks LaShore. And so she was well established in the Obama administration, actually, and she was instrumental in helping getting the ACA through. So she is the new CMS Administrator. And so we'll have to see ultimately in terms of how she will work with the Biden administration in terms of the different laws and legislations that are coming through and what her stance will be on particular things about Medicare and whatnot. So one of the most recent things that I don't know if everyone knows, maybe kind of sorta, right, is the No Surprise Act. And so you might not know because it's not actually in effect yet, but it did pass. And so this is just kind of a summary. And so it had to do with surprise billing, right? There was this huge brouhaha about surprise billing, and so they really took on some of the things that had worked in New York, actually. So like baseball arbitration in regards to a lot of these surprise billing practices. And so, so they were able to get this through actually with the COVID-19 bill. That's really how they were able to get it through. And so really what it covers is essentially almost all settings, right? Emergency, post-stabilization, non-emergency care, in-network, and then, you know, even self-funded plans. And so it's really trying to help patients out in regards to not being given like a huge bill that they had no idea, with all the different facility fees, the physician fees, the, you know, all of that. And so so there's essentially an independent dispute resolution process. That's really what it came down to. And so, and if they're arbiters, and essentially if the loser in terms of that arbitration has to pay out the cost of arbitration. So there's really a big push to try to get, you know, hospitals and insurance companies to essentially settle in regards to the payment structures. And so this will be going into effect starting January of 2022. Okay, so that's likely the reason why you might just maybe had heard about it, but because it's not quite in effect yet, but it's coming. And so I recommend that you kind of look into it. So other things that have been actually put in place or have been submitted is actually, or there's a big push on a lot of different associations, is legislation on prior authorization, right? As spine surgeons, I think unless you do only out of pocket, right, this is an issue for everyone, okay, not just surgeons. And so there's both a House bill and a Senate bill in terms of improving seniors' timely access to care act, actually. And so it was brought up by Raul Ruiz. That's why I kind of mentioned him. And then, and actually Senator Merkowitz as well. And so it essentially is to try to provide so electronic prior authorization programs that require Medicare plans, including Medicare Advantage, they also mentioned this, to adopt electronic prior authorization capabilities. You know, they found when they were doing some of the background that when Medicare Advantage plans denied services, when they were refuted and they were disputed, 75% of them actually got authorized. So there's a major issue with prior authorization. And we all know this, right? Our patients know this, and they're the ones that suffer, right? That's really what it comes down to. And so all of the major medical associations have been getting on board with this particular bill. So, you know, I think it's important. I take care of a lot of Medicare patients. And so, you know, if you want to get into the legislative sphere, you know, you can either speak to your representatives or even your, you know, your academies or whatever, and get involved, because I think that is an important bill to really push for and look out for. There are some bills along the line of like health system reform. So, some of these are related to CHIP, Children's Health Insurance Program for the first one. The Dr. Lorna Breen Healthcare Provider Protection is actually about mental health for healthcare providers. So, you know, just knowing in the landscape there are these things going on, likely not. Obviously, most legislation doesn't pass, so most of these things are not going to pass, but there are probably a few there that are really good to know. So Medicare payment. So there's been a big push. I guess big is a relative term, but for No Pain Act. And so this is a bill to essentially allow non-opioid treatments in a hospital outpatient setting. So I think this is another fair one in the argument that because you know, when you care for patients and you just treat their pain with opioids, you just get discharged with opioids, right? Rather than getting all the other services that they can get in terms of reducing their pain. So I think that's a really interesting one, especially as spine surgeons. And then they did pass the sequestration process. So I don't know if you guys know what that is, but it's like a process of automatically and usually across the board spending reduction cuts when there are budgetary issues. And so the sequestration was canceled for, I think, this year. I want to say until December 31st, 2021 for Medicare cuts. So they were able to band-aid that for now because I think they all recognize that with COVID-19 and the pandemic, it's been a major hardship for hospital systems and providers. And so they were able to do that kind of band-aid. But, you know, this is really just kicking the can down the street, right? Because we know this is looming in terms of cuts, you know, and they done all the E&M coding changes earlier this year, right? You know, shifting things to kind of a little bit more outpatient things. And that's really kind of where they're trying to go, right? And so being aware of this and being advocates for yourself and for your patients, I think is really important. From a more local standpoint, I don't know how many of you are from California, but this is something that's actually, I think, really important to look out for. So if you're from California, this is just my little plug. Who knows what MCRA is? Anyone? Okay, so essentially MCRA is the Medical Injury Compensation Reform Act, which was enacted in 1975 in California, which essentially allowed us to cap medical damages, essentially. And that's what allowed us to practice and have our malpractice in a way that doesn't bankrupt us as providers. And so there is a wealthy out-of-state attorney that has essentially developed two oh gosh, why am I looking at it? Anyhow, they're funding essentially this initiative, and they have gotten the signatures over the required 600,000 to get this ballot measure on the ballot in November of 2022. And essentially, it does away with the caps. And so that's a very scary prospect in California. And so I just, for those Californians out there, it's really important to really push your representatives and your, you know, just let them know that we can't practice in an environment where we don't feel secure. So that's just a little bit about legislation. I hope that's helpful.